Hi, Laura.
So Alex and Shay and I have decided to actually act out our patient family teaching project. We're going to act out as they will be two nurses giving me the patient information on our new schizophrenia medication. I will be the patient in the scenario, learning important information on the new medication I need to be taken. The nurses will be giving me medication to show that I understand how to take it. I will be Susan, a patient that has schizophrenia who is 28 years old, living uptown in St. John. I have a recent drug abuse history and live alone in poverty. I have been in and out of jail and trying to become successful and control my illness. The both of them have prepared a PowerPoint. Well, we all have, but for teaching purposes. So they are going to read over the PowerPoint with pictures and simple explanations. They will be looking at my nonverbal,
like facial
expressions and stuff. And I will also be repeating that I understand this information. So they will be evaluating if I understand. And yeah, we're going to start now.
So what is schizophrenia? Schizophrenia is a chronic disorder. Schizophrenia is the classification of DSM-5 if 2 or more symptoms occur for at least a duration of 6 months, including delusions, hallucinations, disorganized speech and behavior, and negative symptoms. Negative symptoms include lack of pleasure in relationships and lack of life. Schizophrenia is a mental illness that interferes with either a man or a woman's ability to think clearly, manage emotions, make decisions, and build relationships with others. You said that thing.
Good job.
When schizophrenia is not treated properly with the correct medication, it impairs a person's ability to function. A common symptom of schizophrenia is psychosis. It involves hallucinations and delusions and is defined as experience of contact of reality.
Okay. So now they will be starting the PowerPoint, which will be a visual and auto explanation to me as the patient, Susan.
Perfect. So our drug is acinapine. Our trade name is Saffris. And the classification of this drug is an antipsychotic or a mood stabilizer. So what is required for what it is? It's for schizophrenia.
Yeah.
It's for manic episodes and also with bipolar disorder.
Okay, so this medication, acinapine, there's actually a trade name, so is that just another type of drug?
No, it's the same type of drug. The trade name is just the name that will be most heard of, but it's usually specific to one region.
For my schizophrenia?
Right, but it goes a little further than that. It's to manage the symptoms of your schizophrenia and decrease the symptoms as well. And also it is used for bipolar 1 disorder, for having manic episodes. It helps manage that as well and decrease those symptoms too.
Oh, great.
Okay.
Yeah.
Any questions?
No.
So instructions on dosage, that's just a picture for your own information.
Okay.
Okay. It basically just goes over what I just said, the indications, how it works, and things like that. Okay.
Yeah.
So the instructions. So you're going to start out taking 5 milligrams.
Yep.
Twice daily.
Yep.
And then after 1 week, you're going to go up to 10 milligrams. Okay.
Okay, so does that mean twice daily? Do I take it both at the same time, or?
No, you're going to take it 12 hours apart.
Okay.
So 1 in the morning, 1 at nighttime would be the best. It's easier to remember to do that.
And what happens if I miss a dose?
If you miss a dose,
Do not skip or double on doses.
Okay.
Yeah, you do. Yeah. Okay.
Yeah.
We have that in the pamphlet as well for you.
Okay.
Okay. So this is how you're going to take your medication. It's a nice visual for you to see in the pamphlet we've given you. Okay.
Okay, so can you guys just quickly show me?
Yep.
Yeah.
So you're going to it's going to come in a little pack just like in the picture, okay? And you're going to pop it out and put the pack back into the box. And then you're going to peel back the colored tab and you're going to place the tablet under your tongue. That's called sublingual.
Okay.
And you'll let it dissolve and that's how you'll take your medication.
And do not crush it either.
Okay.
Chew it.
Don't chew it.
So basically all I'm doing is putting it underneath my tongue. And am I allowed to have anything to eat or drink?
You should wait.
Okay.
wait.
Okay.
10 minutes, okay?
Okay.
So when you take the medication, the half time is 24 hours. That means that is how long the medication will last in your system.
Okay.
So they recommend for you to take it every 12 hours to keep up the therapeutic dose and keep your body at that therapeutic dose, okay? The peak time for this medication is from half hour to an hour and a half after administration.
Okay.
And we talked about what to do if a dose is missed. Don't double up and try not to skip it in the first place, okay?
Yeah. I'll make sure I take one in the morning and one at night so that I get that therapeutic effect.
Yeah. And then the duration of the medication lasts for 12 to 24 hours.
Okay.
And then the peak is a half hour to 1.5 hours, and then the onset's unknown.
So there's some minor side effects involved with reduced sense of touch or sensation and weight gain, okay?
Okay. So weight gain, so is that a lot, or just if I keep a healthy diet and exercise, it should be okay? Okay.
Should be okay.
Yeah.
Okay. So the drug-to-drug interaction. So we're going to provide you with this list of medications that can cause different effects when taken with acenapine. So you should try to avoid mixing these drugs with acenapine. So if you get prescribed a new prescription, you should keep this list on your fridge or somewhere that's easily accessible, and you can refer back to it and make sure that you're not mixing acenapine with any of these medications. And if you are, then you need to go speak to your family doctor or your healthcare provider.
Okay, so I will be getting a list of medications that I am not allowed to mix with acenapine because it will give me other side effects?
Right.
Yes.
It can cause bigger problems.
Okay. Yeah.
And then for food to drug interactions, it includes caffeine, alcohol, chocolate, and grapefruit.
Okay, so grapefruit. Am I allowed to have a little bit of it, or?
Not at all.
Not at all. Okay. Okay. Yeah, I will take grapefruit out of my fridge.
Yes.
Okay. So storing your medications, you need to keep them at room temperature in a safe area. Make sure they're in the bottle that they come in or the case that they come in. Yeah, don't like take them out and put them in a different bottle conveniently or anything like that. Just keep it in the bottle or the package that it comes in, and keep it out of reach of children and animals, and at room temperature.
Okay, well, I don't have any children or anything, but whatever container you guys have provided, it would be okay just to keep in my medicine cabinet as long as it's in the proper container.
And make sure they don't get moist either.
Okay. Okay, so time to follow up. So sorry, Laura, that you probably couldn't see the PowerPoint in this video. It is really good, so we're going to send it to you on email and hopefully get it through the Dropbox. Before we end this video, I'll be talking about the assessment that they would use for follow-up care. So they would assess my mental status on daily checkups. So seeing how the medication affects my orientation, mood, and behavior. They would restrict amount of the drug to the patient, so me, so they would tell me my dose and how long I need it for, etc. They would assess a weight and BMI throughout therapy. They would monitor my blood pressure standing, sitting, and lying. The checkup, so seeing how the medication affects my orientation, mood, and behavior. They would restrict amount of the drug to the patient, so me, so they would tell me my dose and how long I need it for, etc. They would assess a weight and BMI throughout therapy. They would monitor my blood pressure standing, sitting, and lying. They would ask if there's any signs of depression or suicide, and they would stress the importance for me to notify my family or healthcare providers if I experience, and then they would also get the patient to take the medication, so like how they were explaining it, they were making sure I understood to put the medication under my tongue to evaluate my learning and that I understand this medication. And yeah, that's everything. Thank you.
Thank you.